Hello to people all over 47 of US states and 103 countries who have registered for this series. I think we have 15,000 people already from all over the world registered for this series. Thank you all for tuning in. We're offering our new free series, Expert Series, in order to build an online global community focused on brain health. We'd like to thank Lugano Diamonds for their generous support as our national underwriter. And we thank them also for choosing Aspen Brain Institute as a nonprofit worthy of their support and their values, and for making our Zoom Expert Series free to the public and able to be viewed worldwide. We also thank Alpine Bank for their generous sponsorship over many years, and thanks to our partners at Brain Futures and at the AFAR, American Federation for the Research on Aging. Now, at our Expert Series 2.0, you will hear global leaders, deep thinkers, technology experts, cutting-edge scientists, top-notch doctors, and extraordinary creatives. We hope that their insights will transform the way you care for your brain today in a way that your 80-year-old brain will thank you for. Our Expert Series 2.0 underscores Aspen Brain Institute's mission. We are on a mission to create a brain-healthy planet. And we're doing that by sharing access to the top minds and evidence-based research on brain health, and also by increasing brain health literacy worldwide. So it is my honor and privilege to bring you these new episodes. Let's see what we can learn and explore together. And now to our Expert Series. I want to introduce our next expert speaker, Dr. Marwan Sabbagh, Director of Cleveland Clinic Lou Ruvo Center for Brain Health in Las Vegas. Dr. Sabbagh hopes to work himself out of a job because he has dedicated his career to finding a cure for Alzheimer's and other age-related neurodegenerative diseases. Dr. Sabbagh is a leading investigator for many prominent Alzheimer's prevention and treatment trials. He's also the author of The Alzheimer's Answer, Reduce Your Risk and Keep Your Brain Healthy, with a foreword by Justice Sandra Day O'Connor, who's very interested in this subject. And he's also the author of the Alzheimer's Prevention Cookbook with 100 recipes to boost brain health. Dr. Sabbagh, we're very excited to hear about your excellent work fighting brain disease with brain health. Please, welcome.
Thank you, Ms. Greenwald. And thank you for including me today in the Aspen Brain Institute Expert Series. When I was invited to give this talk, I had a conversation with Glenda, and I sounded like I could give 3 or 4 talks to try to get everything in. So I'll do my best to capture as much as I can. Many of this audience are justifiably and appreciably concerned about their risk, their future, and so let's kind of grasp what that means. When you actually look at the numbers, it is the 6th leading cause of death. And people say, well, how do you die from Alzheimer's? And I say, just come and hang out in my clinic and I'll show you. So the rule of thumb is that for anybody with whatever your life expectancy is supposed to be according to actuarial data, Alzheimer's, dementia, or other dementia will cut that in half. So they may end up dying from pneumonia or bed sores, but the reason they're in the bed to begin with is from Alzheimer's. So it is now the 6th leading cause of death, and it is growing. And when you actually look at this slide right below, you see that in the last 20 to 30 years, all-cause mortality is actually going down, meaning cancer deaths, stroke deaths, heart death, et cetera. But the thing that's going up is that big blue line in the left, is Alzheimer's disease mortality. So we have not made as much progress, or our progress has not been reflected in these data yet. Now, people ask me, and I know I'm going to get this question a lot, is what is the difference between Alzheimer's and dementia? Dementia is the category of disease. Dementia is like saying cancer. If you say you have cancer, you say what kind. So cancer and breast cancer, cancer and prostate cancer. Dementia is the category. Alzheimer's is the type. So the most common type of dementia is Alzheimer's, constituting 2/3 to 3/4 of all dementia. But it is a process that starts by the time you walk into my clinic with dementia. You are seeing people who have had changes in their brain up to 20 years before the first day of forgetfulness. So by the time they come and see me, the dementia is the end of the disease, not the beginning of it. And I want you to understand that there is a preclinical phase. That means that there's a certain segment of people that are having changes in their brain, and then they have the early symptomatic phase is called mild cognitive impairment, where they have memory impairment but not functional impairment. And dementia means that their memory has gotten such bad, or their cognition has gotten so bad that it affects their daily life. Now, it's important that people understand, and I know this audience will reflect this. They did a survey of baby boomers, and clearly the thing that was thought of most or feared most amongst baby boomers, and still to this day, is the presence of Alzheimer's. And we know that up to 1 in 8 baby boomers will develop Alzheimer's. This is very important because baby boomers, when you ask them what are they more concerned, more than loss of financial security, more than cancer, Alzheimer's is the thing that people are afraid of most. Now, so I used to work in Sun City, Arizona, the capital of aging America, and people would go, well, gee, all my friends complain about it, we all laugh it off, it's nothing to worry about, it's just old age, or what we call old timers disease. So what is the difference? If you go from your living room to your kitchen and you do not remember why you went to the kitchen, we call that a senior moment. If you go from your living room to your kitchen and you do not recognize that it's your kitchen, that is not a senior moment. If you haven't seen somebody in 20 years and you can't remember that person's name and you wake up at midnight and say, oh yeah, that was Joe, we call that a senior moment. But if you're confusing your kids with your grandkids and you do not know who's related to who, that is not old age. The reason I say this is that everybody starts out differently, and they start at different time points. They have different lifestyles, different reserve. But the tip of the tongue might be an age-related issue, but when you're repeating yourself, and you're repeating yourself a lot, or saying the same story a lot, or having trouble that you would not have had before, that is not old age. So I want people to understand that Alzheimer's, the beginning of Alzheimer's is not, or at least the beginning of symptomatic Alzheimer's is not old age, but often people mistake it as such.
Dr. Sabbagh, just a moment. I believe you're not on the slide mode, and people can't see the slides. Can you put your computer on slide mode? Is that what we want?
Yes.
Sorry.
Okay. Did they not see any of them?
I'm seeing them.
It's very hard to see them. You're seeing them because you have a very large screen. Other people are watching on smaller screens.
I have a large screen and I'm seeing them, but he must be on slide mode.
Steve is giving me answers right now.
Steve, our producer, will tell us in just a moment.
Everything looks fine now. Thank you. I think it's better.
Sorry to interrupt.
That's okay. So I want to show you this is a slide of a normal brain. And I don't know if you can see my arrow. Can you see my arrow?
I can.
So this area of the brain is called the hippocampus.
No, I
This
can't.
is a normal, healthy brain on the left. The hippocampus, this is where you store short-term memory. So if you're repeating yourself or forgetting your keys, oops, I didn't want to do that. I want to go up. If you look at Alzheimer's, you see a lot of shrinkage, or the brain loses about a third of its volume. And you see this area of the brain, the hippocampus, is severely shrunken. So when they're repeating themselves, not remember they say the same story, or they're misplacing their keys, that's this area of the brain not working anymore. So you see the huge differences in normal versus Alzheimer's. So let's look at what are the risk factors for developing Alzheimer's. We know that there are, I consider there to be two general categories, what we call modifiable and non-modifiable. Clearly, the older you get, that risk is still there. And at age 65, it's 1 in 20. And by age 85, it's 1 in 3. So age is clearly one. Family history doubles or triples your risk, genetic influences, and female gender. And this is reflective of the fact that the human race is getting older, and we're seeing just more and more and more Alzheimer's as we get on. There is some evidence that the incidence is growing, but the prevalence might be starting to flatten finally. So a first degree relative, mother, sister, brother, father, doubles or triples your risk. And if you have two parents affected, that increases your risk 6x. So we do know that family history affects the risk for developing Alzheimer's disease. There is genetics. So there's the APOE genotype. This is a blood test you can get done today. 23andMe, if you spit in a tube and send it to Boston, they'll do your APOE genotype as part of your analysis. And if you carry the 4, that's the right-hand side, if you have 2 copies, your lifetime risk of developing Alzheimer's is 91%. If you have a single copy, it's almost 50%. So we do know that the APOE4 is a risk factor for developing Alzheimer's disease. A lot of people ask me, should you get tested? And the answer is the American Academy of Neurology, American College of Genetics do not recommend testing for people routinely. However, commercial testing is doing it now often. We would say that people who are not having symptomatic symptoms, we would recommend not getting tested. But if they're having symptoms, I often do this in my clinical practice. Then there are modifiable risk factors, and we know that those can be looked at in health conditions. And I want to point out to you that we go through these risk factors a lot: diabetes, obesity, cholesterol, but the thing that's getting a lot of attention lately is high blood pressure. High blood pressure has been shown now that if you aggressively normalize blood pressure and aggressively treat that, that might be a protective effect. And we, of course, know that physical exercise, COG-STEM, which we'll talk about later, can protect. So these are modifiable risk factors, and we think we can improve them. And I'll go through that later. But we also know about something called the cognitive killers. So I say this to you because cognitive killers are things that we don't necessarily cause Alzheimer's, but clearly affect the brain and can affect cognition. Head trauma, as you've heard lots and lots of things about. We know that mood issues can really adversely affect cognition. We know that sleep apnea, particularly untreated sleep apnea, is a risk factor for developing cognitive impairment. And not just dementia, but it actually in itself can cause its own cognitive impairment. And then excessive amounts of alcohol. There is a risk score called the CADI score. I'm a big utilizer of this score, that you can aggregate the risk. And if you actually look at the total risk, we know that we can estimate a person's risk over time for developing Alzheimer's dementia. This is called the CADI score, and I use this in my practice. So this is something we can do a look at. So now I'm moving out of the risk to talk about what you can do about it. And this is important because people ask me all the time, well, okay, I know all this, what am I going to do about it? And I know Dr. Google and I have strong opinions that will differ, I should say, on the approach. So I will hopefully, if I don't get to it in my talk, I'm sure I can answer it in the Q&A session. So the reason I say this to you is that different doctors have different opinions. So I actually did an internet debate with Dr. Perlmutter, Dr. LaPuma, and I, he hosted it. And we know that what I can say to you is that there's clear evidence that to protect your brain, the Mediterranean diet has very, very robust evidence of working. In fact, when they looked at the Mediterranean diet, not in the Mediterranean, but in New York City, to avoid the phenomenon called an epiphenomenon, showed that adherence to a Mediterranean diet, that's fish, whole grains, legumes, a little bit of red wine, a little bit, and vegetables, you did reduce the risk for developing Alzheimer's over time. Risk of progression, risk of conversion to MCI, risk of reducing progression to dementia. So the Mediterranean diet has shown up. But people ask me all the time about keto. And what about keto? Well, there's a lot of evidence that ketogenic diets work. I want to be very clear on this. That we, in fact, for 35, 40 years, we've been using ketogenic diets to treat epilepsy. But keto diets probably make sense in the symptomatic phase. So once you have dementia, ketogenic diets might make sense. But ketogenic diets to prevent Alzheimer's disease, not as clearly decided. The data is much more robust for developing using the Mediterranean diet. And the reason I'm going to talk about this is somebody's going to ask me about coconut oil in this presentation. Coconut oil is a medium chain triglyceride. The medium chain triglyceride is supposed to provide non-insulin sensitive pathway to provide nutrition for the brain, bypassing insulin, because we do know there's insulin resistance in the brain of people with Alzheimer's disease. But if you're going to go coconut oil, you got to go full keto. You can't, eat your cookies and eat coconut oil and think it's going to work. It's either all keto with coconut oil or coconut oil don't bother, because it's not going to work if you're not going into ketosis in its totality. Physical exercise. People ask me, what about physical exercise? Well, the short answer is as much as possible. Please, please, please do it. By the way, this, Glenda, is the short version of the deck, and I'm trying to get through the short version.
Perfect.
So what does the data clearly suggest? That is that physical exercise improves a neurochemical called BDNF. That's the bottom of the slide. BDNF is brain-derived neurotrophic factor, and brain-derived neurotrophic factor is a healing factor that works in the brain. And I will say to you, interestingly enough, I hate running, but I've taken up running because neuroscientists tend to be joggers. And I was asking them why, and they said the fastest way to get your BDNF raised is to jog, not cycle, not everything else. So I've taken up jogging a little bit. Still hate it, but I'm doing more and more of it, and I'm getting a little bit better at it. But the physical exercise is not just do it because every doctor you meet tells you to do it. There's clear evidence it improves circulation, it improves blood flow, it reduces, it gets the neurochemical, and there's actually now a clinical trial of exercise to treat mild cognitive impairment. So it in fact may work better than prescription meds to treat mild cognitive impairment. The third thing I want to say about this is that the National Academy of Sciences, Medicine, and Engineering published a report in 2017 looking at everything: diet, exercise, cognitive stimulation, supplements, and what they said is that there was enough recommendation to recommend three things. One is physical exercise, two is cognitive stimulation, and three is blood pressure management. They did not go into discussions about diets or supplements. They said they're just insufficient recommendations, insufficient data to have a specific recommendation. But the reason I say this to you is that CogStim works, that if you're doing brain healthy activities, whether it be Sudoku, crossword puzzles, learning a new language, playing mahjong, whatever it is. My parents are elderly. My dad's going to be 88 in December, and he's an immigrant to this country, and he's trying to learn Spanish. So I mean, that's a good example of plasticity in the brain. Learning a new language at 88. So CogStim works. Now the question people ask me is how much, how often, intensity. So if I do 3 hours of Sudoku as opposed to 1 hour of Sudoku, am I 3 times more protected? If I do the New York Times crossword puzzle as opposed to the Las Vegas crossword puzzle, am I more protected? These are questions that are not known. And we also know that people who, there's an epiphenomenon that people who do CogStim, also the same people who exercise and eat right and other things, so it may have nothing to do with the CogStim. Do lifestyle interventions really work? Does it really matter that you do all this stuff? And the answer is, ask Dr. Kiva Pelto. She is a fabulously smart geriatrician at the Karolinska Institute. She did a study in Scandinavia called the Finger Study. It was an aggressive lifestyle-directed intervention, 2 years, nutrition, physical exercise, CogStim, management of all the health conditions, and showed that, and this was a very, very aggressive randomized study of elderly people in Scandinavia, and it showed clearly that the people who got the intervention did better on memory scores, had less decline over time, over 2 years, and it actually had an effect that was very, very robust, statistically significant. And this was published in the Lancet, which is one of the top journals in the world. You don't get anything published in the Lancet unless you have top tier scientists. The data is so good that the Alzheimer's Association has invested in the US version of the finger study called the US Pointer Study, which is now being run in 6 sites around the country, which is doing exactly the same thing. Physical exercise, cog stim, social stim, aggressive management of their health conditions, and interventions including nutrition. So this lifestyle intervention study is being done. People always ask me about the MEND protocol. The MEND protocol is a protocol that was first championed by Dr. Bredesen. It has all kinds of things, and this is a multi-directed, lifestyle-oriented protocol. And I think, you know, Dr. Bredesen is somewhat controversial, but his ideas are not. And so I would say to you that yes, it's a good idea, and particularly with the fasting, the exercise, the sleep optimization, the cog stim, et cetera. So I would say that there is something to the MEND protocol. Let's talk about why it matters. The fact is that there has now been multiple studies. The Lancet just came out with a study clearly suggesting that the aggressive intervention around 12 factors can reduce the risk of developing Alzheimer's disease. The World Health Organization did the same thing. The National Academy of Sciences did the same thing. And so we do know that these lifestyle interventions do work. They do reduce the risk for developing Alzheimer's and other dementia by up to 33%. And so there's some evidence that it has benefit. Why does it matter also? So the reason it matters is that if you look at this slide from left to right, you see that changes in the brain start decades, as I said earlier, before you have a memory issue. So if we could have a lifestyle-directed intervention, we may delay, postpone, or prevent the emergence of pathology in the brain, which may delay, postpone, or prevent the emergence of cognitive symptoms down the road. So when people ask me, when should I start? The answer is today. And that's what I say to everybody. I said, and I have to tell you, I'm going to turn 55 in December, and I do everything. I drink the Kool-Aid that I'm telling you about. I believe this stuff. The data is clearly there to support it. And so that's why we got to start early. And in deference to Glenda, I gave the last 2 slides are, because we believe our data so much, we created the first of its kind in the United States, a women's Alzheimer prevention clinic. Maria Shriver came to us in December of 2018 saying, this is the thing she would love to do. And we spent 18 months developing it, creating it. And on June 18th, 2020, after a lot of work, this clinic started. It is a prevention-directed clinic using evidence-based medicine to address all of the lifestyle interventions. Women, why women? Because women get more Alzheimer's than men. That's about 2 to 1. They are more likely to be caregivers. They have menopause. They have other stressors, and so this is why this is a thing. It was featured on the Today Show. 400 people called within 24 hours, and here's some data, early data about our program. So we are very, very excited about the launch of the Women's Alzheimer's Prevention Clinic.
Thank you.
And we hopefully think, we discussed whether this could become a franchise and other places around the country. This is unique. It's the first of its kind. It's only at the Cleveland Clinic in Las Vegas, Nevada. And with that, back to you, Glenda.
Oh, you're brilliant. Thank you so much, Dr. Sabbagh. You did everything we talked about in brilliant short form.
Thank you.
And it really hit home. I think people really understand it because a lot of very top-notch doctors don't exactly push forward that the lifestyle interventions are important and what's the science behind them.
Yes.
So I'd like to ask you a few questions. It
Sure.
may be a little bit repetitive, but it never hurts to say something twice if it's important. My first question is saying that I have heard you say or read that you said this, the importance of brain health cannot be underemphasized. As we get older, our memories are a reflection of our lives. They become more valuable. We need to engage in brain health to prevent cognitive decline and ultimately dementia. I believe that is a quote from you. So I really want to know, and you've already told many things, but I really want to talk about just brain health. We won't talk about so much of the fighting disease as how do we create brain health? And I realize you've given several things, but maybe just go over it again or say, how do we create brain health? Is there a test for brain health? And are we able to match our brain span to our lifespan?
So brain health to me is really although it's become a very catchy term and a lot of people talk about brain health, I'm very specific about cognition and brain health. My goal is to say we're going to preserve cognition, memory, etc. People need to understand that Alzheimer's and dementia is not an inevitability. It is not an inevitability. We have patients go to the very end of their life who are fully intact and fully functional. And so the brain span to match the lifespan can be achievable. But it also means an engagement in committing themselves to doing something on a continuous basis throughout the totality of their life. When my first book came out, I went on a book tour, and I'd be on a TV show for about 20 seconds to say, if I just eat fish, I won't get Alzheimer's. I wish it was that simple, right? You have to do it all. You have to exercise. You have to eat right. You have to have low saturated fat in your diet. You have to sleep correctly, get a full amount of sleep. It's not just that you go to Costco and buy the whole row of supplements and that's good enough. If that doesn't work, you need to do it all.
Okay, I like the answer. I'm just going to ask a couple of little questions. One scientist has said oral bacteria creates inflammation. It sounds counterintuitive. Is it true?
So there's a company in the Bay Area called Cortexime. This CEO of the company is a brilliant young woman. Her name is Casey Lynch. She found that there is a bacteria in the mouth called P. gingivalis. This is actually the common bacteria in the mouth. And this P. gingivalis secretes a protein called the gingipain. And this gingipain is actually a neurotoxin. And so there's clear evidence that oral hygiene and brain disease are linked. So yes, to your question, the answer is yes, they are.
Well, what do we do about that? Is it about keeping your mouth clean or?
More to keep your mouth clean. Aggressive dental hygiene works. This company developed a blocker of this neurotoxin called Core 388. In case you want to know, that's a clinical trial going on right now called the GAIN study, and is in phase 3 clinical trials to treat Alzheimer's.
Really?
Mm-hmm.
Using
this new drug called Core 388.
The drug may help block would be a prevention?
No, this drug is being approved to block this gingipain, this protein that's a neurotoxin. So it's blocking the neurotoxin.
So it will make it more of a protectant than a
correct. So it'll be people with dementia. It's in that.
Fantastic. I've also heard that it's important to start hearing tests early, as our hearing is closely related to our level of cognitive processing.
So the answer to that question is yes. There is clear evidence that sensory impairment can exacerbate cognitive impairment. So vision, hearing, smell can make the cognitive impairment appear worse or actually be worse. That is correct.
Worsen cognitive, okay. And then I think I've heard you say that or other doctors, to prevent Alzheimer's, we need to test and assess early. And I wanted to know how early is early.
So this is, so there's two aspects to that, Glenda, and it's very careful that I put it this way.
Okay.
Anybody who's worried about their memory, any evidence of a memory issue should go seek a doctor, particularly doctors who are kind of tuned into this kind of thing. That's number one. But the question is should there be routine screening like in your annual Medicare physical, right? Yeah. We know that doctors feel comfortable screening you for colon cancer and osteoporosis and cholesterol and depression, but they're not screening you for memory impairment. And there's been a huge amount of controversy around that. The United States Preventative Task Force does not recommend the screening of memory impairment as part of the routine visit. We in the field aggressively disagree with that perspective, but that is the current perspective. So for people who are worried or symptomatic, yes, go see your doctor immediately. But for people who are part of the memory annual screening, that has not been established.
Well, I think that's really important and something we've all got to work on, especially obviously professionals and neurologists. Well, this is too big. We've said all the things. I just had a question. What do you recommend to prevent Alzheimer's? I suppose it's really all the things we've just talked about, but
yes,
you have a specific answer.
Yes. Of course, it's buy my books would be the easiest answer to that question on Amazon.
Books, that's a good
I have 5 books.
Oh, I only know 2, and I want to talk about those in a minute. Is there anything we can do with young children to build a stronger, more resilient brain?
That's a great question, and the answer is, first thing is protect the brain. So head injury has got to be managed better. Second thing is better sleep habits. People learn terrible sleep habits from early in life. Third is CogStim. So cognitive stimulation. So I'm going to tell you a funny story, Glenda.
Okay.
I have 2 sons now. They're both adults. I would be reading to my children at the age of 6 weeks old. I was literally holding them so their head wouldn't flop, and I'm reading to them. And people think you're nuts. And I said, no, I'm a brain neurologist. I know that even if they have no idea what I'm saying, the intake occurred. So I started CogStim very, very, very early in life. And my sons both go to Cornell, so I must have done something right. So who knows? So that's the third thing. So protect the brain, sleep better, CogStim. That's
fantastic. It's relatively what we want for adults, but it's a lot earlier. And I think it's really, really important. And that's another thing where we can get work on getting policies in schools and preschools to really change their emphasis of what the activities are for young kids. With the same efforts that it would take for people to control their risk for Alzheimer's, will these same efforts be able to help people control risk for other dementias, heart disease, diabetes, and accelerate longevity?
So it's a good question because, of course, dementia being the category, there are many kinds of dementia, right? Alzheimer's is the most common type, but there's vascular dementia, Parkinson's dementia, Lewy body dementia, which is what Robin Williams had. I would say that those lifestyle-directed interventions clearly can probably help protect against vascular dementia as well. It's not clear that those kinds of interventions would work as well in other kinds of dementia like frontotemporal dementia or Lewy body dementia or things like that.
But it would be the same sort of risk factors for heart disease, diabetes, and even longevity?
Correct.
How much do genetics affect our brain destiny? Would it be important to get a preventive genetics scan or a whole genome scan?
Yeah, so whole genome sequencing, you're have a very, very highly informed audience. As you told me, they're very, very well informed audience.
Sophisticated.
Whole genome sequencing is the future, very clearly the future. And, we don't have a way to manage your whole genome sequencing yet. So let's say I go out and get a whole genome sequencing and find things. The best you can do is what we're doing now, but that is the future, exactly right. Precision medicine is coming, and whole genome sequencing, we don't have CRISPR yet to alter our genomes, but all it would do is kind of help you protect, do lifestyle-related interventions.
Take it more seriously.
But I think the future, the one who asked the question is right. That's where the field is going. I am not sure it's going to happen in my career. I think it could happen a little later than that. That's taking the discovery and applying it in clinical practice usually is
something to look
a lag.
Positive to look forward to.
Yeah.
Just a moment. I think we've really, I guess I'll ask the question anyway. When we were first talking about this talk that you were going to give, it was saying something about looking toward a model, or either a world without Alzheimer's or looking toward a model of Alzheimer's that is treatable or preventable. Do you still feel that in general, that you can say things like that?
Yeah, so I think that generationally, we're going to transform Alzheimer's from a terminal disease, as your audience knows it, to a chronic disease. This is the diabetes and HIV of our lifetime. I think that's actually a movement that's underway. I think that's going to happen now. So I don't see that not happening. But the idea of prevention means that we got to look at Alzheimer's not as a disease of the aging, but a disease of lifetime, of the lifespan. Sometime in the future, we will, just like to do for, thalassemia, and, you're going to get a little finger prick and they'll say, okay, you're going to get Alzheimer's, 75 years from now, and they'll vaccinate you or something like that. So I think that when we're trying to re-engineer Alzheimer's as a disease of the lifespan, and eventually we may vaccinate it away. But we're not quite there yet. I want to say that again, that's a thing down the road.
Okay. This is just a small question. I was really taken with the fact that you did your own cookbook. You did a cookbook to boost, no.
Yeah, so if you actually look, I actually wrote the first 85 pages of the book, and then I partnered with a celebrity chef. I'm not a chef. I want to be very clear to this audience. I tried them all. They're really delicious. The celebrity chef, Bo McMillan, who beat Bobby Flay on Iron Chef America, he's a Food Network chef. Bo McMillan partnered with me, and I said, here, Bo, here's the ingredients list. Here's the strategy, go for it. And then he just went to his kitchen and created these 100 recipes on his own. So I wrote just the why should you eat well, and here's how to eat well. It's not a prescriptive diet like a South Beach. It's kind of a snapshot of how would healthy eating look like.
Well, Aspen Brain Institute is just going to start in November a brain healthy cooking series. So we want to make sure that we have you and Bo McMillan on to tell us
He's
what
awesome.
are the brain healthy recipes.
He's fantastic.
Now I'm going to look at all these questions that have come in. So if you'll give me just a moment, these are really big. I mean, they're long questions. Here's a short one. How does stress contribute to dementia?
Yeah. So stress, people viscerally say stress is bad, and that's true. Stress elevates cortisol and disrupts sleep. So the two ways it's going to affect cognition is by elevating cortisol levels and disrupting sleep, which are both going to be adverse for the brain. But stress causing dementia by itself is not clearly linked.
Okay. Can drugs increasing NAD and AD levels protect against Alzheimer's?
Interesting questions. So again, very, very highly informed audience. NAD is going to affect your mitochondria. And your mitochondria are your batteries, your Duracells in your cells. So the idea that you could improve NAD levels would be great. People have shown that mitochondrial activity does diminish in Alzheimer's disease, and there have been theoretical proposals about boosting mitochondria. It just hasn't been achieved in a robust way, but that idea makes sense. It just hasn't been achieved well yet.
Okay. Can you comment on metformin and Alzheimer's?
Yes, so again, a very well informed audience. People are following Dr. Passanetti's work at Mount Sinai in New York.
Or
Dr.
Barzilai, Dr.
Huh?
Barzilai, Dr. Barzilai.
Okay, but Passanetti's doing the work. Dr.
Oh,
Passanetti is doing the work
Thank you.
at Mount Sinai in New York. Dr. Passanetti has shown that you can improve glucose metabolism in the brain. And he has proposed that it could be a strategy because we know that the glucose metabolism does go down in Alzheimer's disease. It is correct. And some people have decided to start taking metformin even if they are not diabetic to improve their brain function. And I myself have, as a practicing neurologist, have prescribed it on a couple of occasions. I will say to you that in clinical practice, I'm not sure I've seen it as robust effect as I would like, but there is a good logic behind it. And in fact, I was one of the people who reviewed that grant for the NIH. So I know the science is very, very solid behind it. And I will say to you that the clinical trial to determine whether it's effective is underway.
Okay. You mentioned the benefit of fasting. Will you explain the state of evidence for fasting in terms of reducing Alzheimer's risk?
So fasting is kind of going down the keto route because you go back into, you reduce your gluconeogenesis and go into ketosis, which is supposed to spare the insulin pathways and create the insulin bypass pathways. So the idea is that you're going the ketosis route, which would have positive effects on your brain because you're not then relying on insulin, and you're in theory reducing insulin resistance over time. The data suggests that fasting does work for longevity. This is the Walter Longo work, but some benefit in brain as well.
Well, the questions are pretty wild. This is a question from a person who says she is a 56-year-old female and has 2 copies of the APOE4 allele. What supplements would you recommend?
I would say to that audience, look up womenpreventalz.org and come and see us at the Women's Alzheimer Prevention Clinic.
Great. Tell us that again.
Womenpreventalz.org.
Great. Thank you. By the way, did you say you are starting or will start some clinical trials with some of the women that come into the...
Not that clinic. We actually have a huge suite of clinical trials at the Cleveland Clinic in Nevada, but that is separate from the Women's Alzheimer Prevention Clinic.
But are there any in yours that relate to women, that are for women?
We are doing a prevention trial now called the AHEAD study, which is looking at a drug to remove amyloid out of the brain. This is a national study being done around the country.
Okay.
It's not specifically for women, it's for all genders, both genders.
Well, this we've sort of talked about, but it's a little more specific. Would it be helpful to get a cognitive assessment as a baseline?
Excellent. That's an interesting question and a controversial question. The answer is yes, we think that's a good idea. But the majority of the field does not feel like that is necessarily a good idea. So the answer is personally yes, but the United States Preventive Task Force does not recommend routine cognitive screening.
Tell me who's in this task force.
Yeah, you need to go talk to them, please. I know you're very influential as a advocate. So maybe you can talk some sense into them. It's
They
ridiculous.
sound like they're not thinking so,
They're not. We agree.
okay. That's another conversation. Someone else is asking how much exercise is optimal, how
Right.
strenuous, aerobic versus weight training. I
So
think most of that one.
the answer is right now, the current guidelines are you follow the cardiovascular guidelines. So 150 minutes a week of strenuous exercise. So something that would put your pulse 80% of 60, 80% of maximum. Aerobic seems to be better for the brain than isometric, although isometric now has been shown to be more robust in terms of burning fat, but aerobic is better. So those are the current guidelines.
That was one of my last questions to you, that when we first talked, you told me after seeing hundreds of debilitated Alzheimer's patients, you at age, whichever you are, we're going to take up running and meditation.
And I did both.
Fascinating. And I wanted to know if you kept up.
Yes and yes. My 2020 goals included meditating this year and traveling less. And I have to tell you, I never planned on COVID as the reason to travel less, but I've achieved both very, very well.
It's interesting. It's one of the positive effects of staying home more. You have more time for that. Maybe two more questions. Are you hopeful for the Biogen drug? I don't know if I can say it.
Aducanumab.
No, aducanumab.
Yeah.
So
the answer is you got strong opinions on both sides of that. But I will say to you that I think there's a 50-50 chance that on November 6th, the FDA will approve it. I know that they're reviewing the data, the package on November 6th. We're bullish about it at the Cleveland Clinic to the point where we plan to be the first people in the country to be administering that drug.
Oh.
We think that the data, you understand, it's baby steps. It's not like you're going to cure people. We know that the drug clears out amyloid out of the brain very clearly, and its competing brands clear amyloid out of the brain. We also know that it's over the span of 18 months, it starts to slow the rate of decline in a substantive way. But it doesn't stop the disease. And the treatment success is you're making somebody less worse over time. Still getting worse, just less worse.
But you would have the disease in order to slow it down.
Correct. Use people with mild cognitive impairment or early dementia, mild dementia. That's correct.
Well, then I want to ask you two last ones. What keeps you up at night and what makes you optimistic? If you could think of those.
What keeps me up at night? I know that many people are frustrated that we're not making enough progress or making progress enough. What keeps me up at night is that doctors cannot diagnose this disease and they don't feel good about it. They don't feel comfortable, competent, skilled. I think people are delayed in getting a proper and correct diagnosis. There's multiple people trying to create educational initiatives to make physicians understand that what you learned is that you can only diagnose Alzheimer's disease with an autopsy. That is not true anymore. That is absolutely not true anymore. We can actually make a diagnosis with great accuracy in life. Just people aren't doing it. It's just not a matter of they can do it. A clinical diagnosis, the accuracy of a clinical diagnosis of Alzheimer's is only 70% right. But we now have biomarkers and other technologies that can push it over 90% accuracy. And so that keeps me up at night, is that people don't know how to take care of this condition. They don't know how to diagnose it. They don't know how to manage it. And my day job is doing this, Glenn. In fact, right after I'm done with this WebEx, I'm going back into the clinic. I still see patients, even though I'm the director of the Cleveland Clinic in Nevada, I still see patients. So my day job is to take care of people with this condition. So I feel that the medical profession struggles with this. If we could just get that to the doctors making a diagnosis, feeling comfortable making a diagnosis, that would be hugely successful.
We
What
would-
am I optimistic about?
No, but we would want to see a neurologist. If we want to find someone who can diagnose Alzheimer's while we're alive, what type of doctor must we see?
Well, the short answer is jump on a plane and come and see us at the Cleveland Clinic.
Will do.
That's the short answer.
You're the best one in the entire western half of the United States.
I won't disagree with you on that. But seriously, I do think that neurologists, but you got to get buy-in from at every level. That means physicians need to have that conversation. When a person often goes to a primary care physician and complains about their memory, the most common thing to happen is that the physician dismisses it, diminishes it, downplays it, says there's nothing wrong, don't worry about it, you're just stressed, you're having trouble sleeping, you're depressed, they're not evaluating the cause of the memory complaint. So the first thing that needs to happen is a systemic re-engineering of the system, where physicians need to take this complaint seriously.
Great.
The second thing, of course, is then refer to specialists. And there are specialists all around the country that do what I do. I mean, I know them all. I know all the doctors that do what I do in the country. There are that few of us, unfortunately. But there are memory clinics around the country that specialize in this kind of thing.
Thank you. And so what are you optimistic about?
I'm optimistic that we will transform Alzheimer's from a terminal disease to a chronic disease. Sometime in the near future, a person will be diagnosed with mild symptoms. We'll confirm that they have Alzheimer pathology. We'll put them on a chemotherapy type cocktail approach, and they will stay the same. They will not get worse over time. I would love to see the nursing homes and memory care business go out of business because there are just so few people going into them. We know that a patient they'll spend up to 20 to 33% of their life in a memory care facility. That's the standard in America. What we'd love to see, of course, is that we would go from that 33 down to 5%, right? So that they can have more quality of life. Our goal, people to me talk about cure. I don't talk about cure. What I talk about is that a person can live well and long and robust and have a full life, the full span of their life, even when they have mild memory symptoms, to the point where it becomes an annoyance, but not a problem. And so I think this is our future, and that's what I'm optimistic about.
Fantastic. Well, we've run out of time, and I want to thank our outstanding expert, Dr. Marwan Sabbagh.
Thank you.
Thank you for sharing all of your knowledge and your optimism and your clarity of thought and your progressive vision about where we are with this dreaded disease. And I thank our audience for tuning in and getting educated and updated on the science of brain health. And thanks again to our sponsors, Lugano Diamonds and Alpine Bank. And I want to remind everyone that this session was recorded and will be available on our website, www.aspenbraininstitute.org. Please check our website to sign up for the next episode, and you can also sign up for the whole series if you like. Thanks again, and ciao, everyone.
Thank you.
Thank you.